Suicide is a major public health concern. The rate of suicide among all Alaskans in 2017 at 26.9 per 100,000 was nearly 2 times higher than the national rate. For Alaska Native people in 2017, the rate was more than 3 times higher than the national rate at 51.9 per 100,000. Over 48,000 people died by suicide in the United States in 2018. It is the 10th leading cause of death overall and the 6th leading cause of death in Alaska. Suicide is complicated and tragic, but it is often preventable. Knowing the warning signs for suicide and how to get help can save lives. Signs and symptoms. Talking about wanting to die or wanting to kill themselves. Talking about feeling empty, hopeless, or having no reason to live. Making a plan or looking for a way to kill themselves. Talking about great guilt or shame. Talking about feeling trapped or feeling that there are no solutions. Talking about being a burden to others. Excessively using alcohol or drugs more often. Withdrawing from family and friends. Taking great risks that could lead to death, such as driving extremely fast. Talking or thinking about death often. Displaying extreme mood swings, suddenly changing from very sad to very calm or happy. Giving away important possessions. Saying goodbye to friends and family. Putting affairs in order. Making a will.
Suicide does not discriminate. There is no typical suicide victim. People of all genders, ages, and ethnicities can be at risk. Suicidal behavior is complex and there is no single cause. Many different factors contribute to someone making a suicide attempt, but people most at risk tend to share specific characteristics. Main risk factors for suicide are previous suicide attempts or self-inflicted injury, history of trauma or loss, serious illness, physical or chronic pain or impairment, alcohol and drug abuse, mental or emotional disorders, particularly depression and bipolar disorder, social isolation or a pattern history of aggressive and antisocial behavior, discharge from inpatient psychiatric care, access to lethal means and coupled with suicidal thoughts, family history of a mental disorder or substance abuse or suicide, family violence including physical or sexual abuse, having guns or other firearms in the home, having recently been released from prison or jail, and being exposed to other suicidal behavior such as that of family members, peers, or celebrities. If these warning signs apply to you or someone you know, get help as soon as possible, particularly if the behavior is new or has increased recently. Call 911 if in critical need. Many people have some of these risk factors but do not attempt suicide. It is important to note that suicide is not a normal response to stress. Suicidal thoughts or actions are a sign of extreme distress, not a harmless bid for attention, and should not be ignored. If you are concerned about yourself or someone else, there are local resources and national resources to help. To speak with someone locally, call Public Safety at 546-3130. The National Suicide Prevention Hotline can be reached at 1-800-273-8255, or you can text HELLO to 741-741.